Those air quality concerns all across our area today, and we want to make sure your questions are answered. We want to welcome in Kiki Borst. She's with the Community Health Net, and you guys have been talking about these air quality concerns with patients for the past couple of weeks, really since the first time we saw this smoke kind of come into our area.
What are common complaints that people have when they call?
People have cold-like symptoms, allergy symptoms. They feel that that's what's kicking up. Any asthmatic may have some difficulty breathing. You know, the children we're wanted to talk about especially, they're predisposed. They have a smaller airways. They're outside more playing, things like that. So we want to make sure they're safe during this.
What would you recommend to parents of young children right now? Should we keep them in? Should we, should we just kind of see how they play and how it goes? And
well, I mean, Dr. Berkmeyer and I spoke this morning, and as much as we don't want to hear this on a holiday weekend, if things don't subside a little bit, we really recommend they stay in and actually even wear an N95 mask. And if they are an asthmatic or predisposition to anything like that, then they need to have their inhalers refilled, their albuterol treatments. Make sure that there's not expired from sitting in the cupboard from last year, those sort of things.
Good point.
We recommend that even if it's not that warm out, to turn on the air conditioner, especially if central air. That helps filter things out a little bit. Keep windows rolled up. You know, none of us want to hear that with little kids.
I wondered about that, like with the air conditioning units, whether they're built in or if they're air that doesn't bring in any of that smoke as it's recycling.
There's some it's filtered out with the filter with the conditioner.
You know, I have 3 little boys, and we're just coming off 2 rainy days, so it's like you want to get them outside. Is there any safe amount of time, go play out for 10 minutes or not really when it's this bad
Not when it's this bad. I wouldn't take a chance like that. It sets them up.
I know.
Or rent movies, have movie night, popcorn night.
Sure.
That's what I would recommend till it clears.
Well, and you also were telling us off camera too that sometimes if you're predisposed, it can lead to other infections. Explain a little bit how that can happen.
Well, your body reacts to allergens, irritants by making secretions. It's not so much that the smoke's causing infection, but it's setting up an environment for viruses and bacteria to grow. So, like we talked about earlier, you may see next week people coming in with sinus type infections or things like that.
Interesting. So this could be something that, like you had said, we feel kind of crummy today. We might feel it in our throat today, but next week we might be.
Especially if you're predisposed, if you have history of allergen reaction or things like that. So we recommend that if you have prescribed medications, take them daily. Don't just take them when you feel sick. If you have allergy medications, things like that, refill your albuterol, your inhalers, your daily inhalers.
I like that reminder. Check the expiration. Make sure that you've got everything you need on hand.
Sometimes you stick that stuff in the cupboard and you're looking for it. So
especially
with children, which is what we're referring to right now, we want to make sure that the parents know, grandparents, schools, or camps, preschools, whatever.
And we should note that a lot of MYAA and EYSA, I believe, have canceled all their outdoor activities. I would assume that you think that's the smart move.
Right. We recommend it.
Well, be mindful of it. Appreciate you coming in today and kind of sharing your expertise with us, especially when it comes to the little ones.
Thank you.